Okay, this is a public service announcement. I saw a patient recently who told me during her consult with me that she followed the plastic surgeon that she went with for her surgery on Instagram and liked the results, checked out the credentials, was happy with everything, went from where I am in the Seattle area to Florida to have surgery and stayed there for a couple weeks, I think, recovering from her breast augmentation and lift. And at that point, she had some signs of what was considered maybe like a minor post-op infection. Started her on some antibiotics, and then she flew back home. Things worsened quite dramatically, and now she's back in this area, and you know, going to the emergency room a few times, getting IV antibiotics, getting different antibiotics, and it's a bit of a mess. And that's not at all to say that complications don't happen. They do. Every surgeon has complications. Every doctor has complications. We do our best. Things happen. That's not the point. The point is when you are operated on by someone and then you leave that surgeon and you find someone else to care for you, it's a serious challenge for the next doctor, and it's poor continuity of care, and there's no one to blame but yourself. And I understand people want to get a good deal or they want to find, the best surgeon for them, and I support you getting, the best surgeon for you, but just keep that in mind. When there's complications, before your surgery, hope for the best and plan for the worst. Plan for it, because it can happen, and when it happens to you and you didn't expect it and you didn't think it was going to happen, then you're just not in a good space. And especially if you've gone to Thailand or Mexico and then you come back to Washington, and you don't want to go back to Thailand or Mexico because it's a lot of travel and it's a lot of expense. It's very hard to get things dealt with. There are some plastic surgeons in this area who just will not take those patients on, and just absolutely refuse them. I'm not one of them. I will take the patients on. This patient probably is going to be needing weeks of wound care, possibly another surgery or two, possibly removal of a breast implant, and then maybe 3 to 6 months down the road putting the implant back in and maybe doing some fat grafting. I mean, it's a serious complication, and it's not awesome. And the continuity of care is not great, and I really am frustrated on her behalf, but she's doing the best she can.